You know, in the high-stakes world of ECMO, a simple mix-up in words can have some pretty serious consequences. So today, we're going to focus on what might be the most critical safety tool we have, our language. We're going to build a clear, universal vocabulary for every single part of an ECMO circuit. Let's dive in.
So, right off the bat, let me ask you this. That part of the circuit that pulls blood from the patient, what do you call it? Is it the suction limb, the access line? Maybe you call it the venous drainage cannula? If you've heard all three, or if you're even hesitating for a second, then you already get why this conversation is so incredibly important. And this isn't just some hypothetical scenario. This is the reality in hospitals everywhere. The source material for this explainer puts it perfectly. The exact same piece of tubing can have a bunch of different names, and it all depends on where you work, who's on shift, or even which doctor you're talking to. And that's just a recipe for confusion when things get stressful. Okay, so if we're going to build a common language, we have to start with the two most basic functions of any ECMO circuit. Everything, and I mean everything, comes down to understanding the difference between drainage and return. It really is this simple. On one side, you've got drainage. Just think of it as the exit ramp for blood leaving the patient's body. That deoxygenated blood gets pulled out and into the circuit. Then, on the other side, you have return. That's the on-ramp. After the machine works its magic, fresh oxygenated blood is sent right back to the patient. Drainage and return. Every single term we're going to talk about today fits into one of those two buckets. All right, let's tackle that first big function, drainage. This is where you see a ton of different terms thrown around. So we're going to sort through the common ones, the not so common ones, and the ones that are just plain confusing. Now, what I love about this is how it organizes the chaos for us. You see the common drainage terms, right? Venous drainage, access line. These are the ones you're going to hear most often, the ones that are widely understood. But then look over at the less common terms, like negative limb or suction limb. Now, they kind of make sense, but they aren't standard ELSO terminology. And ELSO, the Extracorporeal Life Support Organization, is really the key to getting everyone on the same page. Okay, this one is so important to get right because it's all about perspective. You might hear the drainage line called the inflow cannula, and that's one of the most confusing terms out there, because inflow totally sounds like something is going into the patient, right? But you have to remember, the frame of reference here is the ECMO machine. It's blood flowing into the machine. Getting that one little detail straight can prevent so much confusion. Okay, we've got the drainage side all cleared up. Now let's use that same logic for the other half of the circuit, the return line. This is where all that oxygenated blood heads back to the patient. And look at that, it's pretty much the same pattern on the return side. You've got your super common, clear terms like arterial return or venous return, depending on the type of ECMO, but then you might also run into these less standard terms like positive limb or even effluent limb, which you actually hear more in things like dialysis. Just knowing that these other names exist is half the battle. And here it is again, that tricky little perspective shift. The return cannula is sometimes called the outflow cannula. And just like before, it has nothing to do with the patient's perspective. It's all about the machine. This is blood flowing out of the ECMO machine. So if you can just lock this into your brain, inflow is into the machine, outflow is out of the machine. You've pretty much cracked the code on ECMO terminology.
So we've broken down all these different terms, but let's just pull back for a second and look at the big picture. Why does spending time on what we call things matter so much in a field as complex as this?
Well, it matters because in ECMO care, literally every single second and every single word counts. When everyone uses the same clear, standard language, it stops dangerous misunderstandings during handoffs and makes sure we're all on the same page when we're trying to troubleshoot the circuit. And most importantly, during an emergency, you just don't have time to ask, wait, which line are you talking about? Using standard terms that line up with the ALSO guidelines saves precious time, and that can save lives. It's that simple. I want to leave you with this really powerful thought, because it just gets right to the heart of everything we've been talking about. You can be the absolute best ECMO specialist in the world, a total wizard with the technical skills. But if you can't communicate clearly with your team, none of that matters as much. Communication is a clinical skill, period. So we'll end with this one question for you to think about. Take a second and really consider your own team, your own unit. Does everyone you work with use the same terms for the same parts? If the answer is no, or even I'm not sure, then maybe it's time to start that conversation. Because making sure you all speak the same language is one of the single most important things you can do for your patients.